Good afternoon, my friends. Happy Wednesday. The doctor is in the house. Welcome, Dr. G. We are joined here today in pure, I said it, pure awesomeness. We're going to be talking about a great topic today. I tell you what, Fad Diets 101. You guys have asked for it. I'm bringing you the show today because we're going to continue to do better. We're going to move better collectively. I want, at the end of the day, of course, those of you that keep joining us here on Two Health with Dr. G, we want you to have the resources to be successful in all aspects of your health, because when you're health, you're more than likely to have success in your life. Absolutely true. Again, welcome back. My name is Dr. Mark. I'm a board-certified internal medicine physician practicing out at Edward Hospital. I'm also a member of the American College of Lifestyle Medicine. That's right, lifestyle medicine. That's what it's all about. I'm so excited to welcome everybody back here today to another episode of To Your Health with Dr. G. I have some fierce guests today. And again, it's all about you. That's why my wife and I created this show, To Your Health with Dr. G, to make sure that you, again, succeed. We don't want any failure anymore. You know, we're by too many chronic disease burdens that are preventable through lifestyle. And realize this, your daily choices matter more than most of us think. So we got to talk about it. That's why I love doing this show each and every week, to keep the conversation going on. And again, I don't want anybody to let this conversation die down. The most important thing you can do today is share this show. Share the message. We want engagement. Turn that inaction into action. You're joining us here live on Facebook. We're at Intellectual Radio Studios. Check me out on my website, www.drmarkgomez.com. And I check this out. I'm so excited. So Fad Diet. So here's the deal. We're going to break it down. You guys have been seeing all my stuff on social media this week, talking about just not only fierce guests, but talking about, again, this opportunity that lies right in front of our faces. An opportunity to live better, to feel better, to enjoy your life, to prioritize the important things that you've got going on for you, to make your health just awesome. As I said a few months ago, pure awesomeness, because I love having these kind of great discussions with some awesome people. So you're going to hear nutrition without a doubt, Fad Diets 101. We're going to talk about what the evidence says. We're going to talk about really how to make those changes, how to take those first steps to better your health. I put something out on social media the other day about the cigarette diets in the 1920s and the cabbage soup diets back in the 1950s. You know what? Fad diets are here to stay, but we're going to set the record straight. Again, we're all about building trust and delivering truth. So here we go. Before we introduce my guest, I want to read you a quote. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So my panel is fierce as always. I love it. And I have a connection with each of these guests today, and I cannot wait for them to tell you their story. They really care about your health and what you want to do. They want to get you to that next level. If you're kind of stuck in mediocrity with your health, they're going to inspire you to take it to the next level. Again, the opportunities are right in front of our face. We cannot let these opportunities go unchecked. We got to do what we got to do. So I'm so excited. Let me introduce my guest to you. My first guest, he and I go way back. Longtime friend of mine, colleague, just expert. He's a lifestyle medicine enthusiast like me. I want to introduce my good friend, Dr. John Saran. Let me read his credentials. Dr. John Saran, great friend of mine. He's a board-certified internist with Edward-Elmhurst Health. Check him out at www.eehealth.org. He's also an affiliate physician with MDVIP. Check him out, www.mdvip.com. Dr. Saran, welcome to the show.
Well, thank you, Mark. Here's the skinny. Fenwick High School, Northwestern, 3 years, biochemistry.
Very nice.
Skipped a year over to Loyola. I think you're a Loyola.
Yeah, I'm a Loyola guy myself.
Loyola Med School, Loyola Internal Medicine. And for a while, practiced at Good Sam and over to Edward Hospital. But really, the big change came in 2006 when I was able to reduce the size of my practice into an MD VIP and Edward-based practice and really do what I love to do, which is passion for lifestyle medicine. And because us doctors really don't get a lot of nutrition in medical school, I think you can attest to that.
Absolutely.
I had to go to books and DVDs and lectures and speakers and learn all about nutrition, which is my passion.
Wonderful. Well, thank you, Dr. Saran, for coming on the show today. I cannot wait to get more granular, get into some of the fine details on everything today. Let me introduce my second guest. She's a return guest. Dr. G, I like her so much. I want her to come back on, but she's also a fellow lifestyle medicine enthusiast, and she and I connected a while back, about a little bit over a year ago, at an event put on by our hospital, and we've just been great friends and colleagues since. And I just wanted her to come back on and just preach, essentially, just tell you what's going on. I want to introduce my great friend. Her name is Her name is Lisa Murphy. Let me read her credentials because her credentials run deep. Lisa Murphy, she's a board-certified advanced nurse practitioner, Endeavor, and she's with Edward-Elmhurst Health. Check her out, www.eehealth.org. Lisa, welcome back to the show.
Thank you very much for having me, Dr. G. A little of my background.
Please.
I'm a family nurse practitioner. I worked as a nurse for 10 years. I completed my training at Rush Medical Center. I worked as a nurse and then realized quickly that I wanted to really help patients heal from a provider standpoint. So once I completed my degree, I did family medicine for about 3 years and then decided to start working in an area of medicine called lifestyle medicine and obesity medicine. And most recently, I've been working on my doctorate in nursing practice, which will be a concentration in lifestyle medicine. So right now, I help patients lose weight in my clinic, and I help them lose weight and gain quality of life. And I do that with a really great team. And again, just piggybacking off, I also did not get a lot of nutrition training. So I have essentially done a lot of self-teaching, and it is absolutely my passion as well.
Wonderful. Well, so glad to have you back on this show. Thanks again, Lisa. I want to introduce my last guest. She and I connected through a local, actually small business owners group not too long ago and everything. And I heard her story. I've seen some videos that you've done on social media, even with colleagues that we know in common. So I had to have her on. I want to introduce my good friend, Cristy Chuparkoff. She's an RDN, LDN registered and licensed dietitian nutritionist. Check her out on her LinkedIn, www.linkedin.com/in/Cristy Chuparkoff. Cristy, welcome to the show.
Thank you so much for having me.
Hey, please tell us a little bit about your background and a few opening words on what this theme means to you today about the dietary challenges that we face.
Yeah, absolutely. So as you said, I'm a registered dietitian. I graduated from the University of Illinois at Chicago. And I was introduced to functional medicine by a chiropractor friend of mine and just always wanted to learn that. The real shift for me happened with my own story. I had eczema my whole entire life, and through making some diets and supporting my body with some supplementation, my eczema healed, and I had no. So I love dealing with food sensitivities and that sort of thing, functional medicine. For work, I do some early intervention with infants and toddlers, some sensory feedings. Is sort of like my specialty, sensory feedings, and then with adults, I do some kitchen coaching and cooking classes.
Wonderful. Well, thank you, Cristy, for coming on to the show today. So there you guys go. You met my panel, just great credentialed individuals that are passionate about your health and your well-being. And here's the deal. Before we get into our clinical question of the hour, aka the chief complaint, let me just lay this down. Nutrition plays a major role in almost every aspect of your health and in your life. It affects every single system in the human body. That's why it's such an important thing. And we want to get rid of some of the mixed messages that are set out there. We want people to be certainly armed with the right information so they can apply that and become engaged in their life and their well-being. So I just want to lovely just get into this thing. This is going to be awesome. And by the way, the word diet, aka what we call a healthy eating pattern, derived from Greek. And the word in Greek is diatia, which means way of life. So in essence, your healthy eating patterns are a way of life. So the chief complaint, and you guys know this from clinical practice, the chief complaint is when somebody comes into our office, they tell us why they're there. And so here it is, the chief complaint of today's show, the question of the hour. Which dietary practices help treat, reverse, and prevent lifestyle-related chronic disease? I'm going to ask Dr. Saran, where do we start? Why don't you paint a picture of just the disease burden that we're up against right now? Why don't we just compete? I think we have to establish that first before we talk about practical solutions. So go ahead and just paint for us what we're up against right now with chronic disease burden.
Well, the chronic diseases that we see in internal medicine are the ones you hear about all the time. So that's heart disease, cancer, diabetes, dementia, all kinds of musculoskeletal disorders. And definitely there's a huge link between nutrition. So we like to teach that a plant-based diet, I think the data is pretty clear. Plant-based, for the most part, is going to help reduce the risk of getting those diseases in the first place and managing and doing better with those diseases if you do have them. So that's what we teach. And it's a matter of balance too, meeting people where they are, making some simple changes. And people think of, I think a lot of people think of food as just fuel or just calories. Well, I think they have to learn to think about food in a different way. It's just not burning calories for fuel. Everything we put in our body, you should ask yourself, when I put this thing in my body, reach it for my mouth, is it going to help me or is it going to hurt me? And if you ask yourself that question, I think you can make some good decisions right there. But everything we eat are the raw materials for every cell in our body, both form and function, the structure, the enzymes. And I think people realize that. They think they'll make some better choices.
Absolutely. Lisa, why don't you give us an idea? Why don't you paint, again, well, let's paint this foundation first before we talk about the practical solutions that are out there. What is the standard American diet? People talk about that, but I don't think everybody really realizes it. What's kind of your take on that?
Okay. So the standard American diet is actually basically, I think the last set of data that I saw around 2017 is about 53% processed foods. So these are contain chemicals, might have higher pesticide levels, processed oils, and so forth. There's a high animal factor to the standard American diet. I think about 32% of total intake, it probably is higher. And then very, very little fruits, veggies, whole grains, and legumes, which are the probably the most important part of the entire diet. So what we've essentially in diet is take the plant-powered eating pattern and reverse it into heavily animal-laden and also chemical-laden processed, and essentially replace the diet with that pattern.
Yeah, it's interesting when you talk about the pattern that's happening. Certainly refined foods, refined sugars, refined flours, high sugar content, low mineral density, and that's the reality. When Dr. Saran was talking about how every cell in the body can be affected, we have to really understand what's happening before we can actually have the solutions.
And Lisa, I've got another great acronym. I quote Dr. Greger. It's CRAP. Calorie rich and processed.
I like that. Oh, yeah.
So I go beyond the sad diet. I call it the crap diet.
Yeah. Because standard American diet does say we're sad. I like that.
Calorie rich and processed food diet.
Cristy, so why don't you give us your take? From a dietitian at the table. Again, I want your take on just the standard American diet because I think it's important to have you here on that one. When Lisa or Dr. Saran or I are talking about again the actual foods that are the ones that we were talking about that are high in fat, processed, high in refined flours, high in sugar. What foods are we talking about?
So we're talking about the things that are not perishable. So if you've ever
McDonald's,
seen, like McDonald's, or have you ever seen that they lay a Twinkie out? It looks exactly the same many years later. Same with McDonald's hamburger. Not to call anything out, but
it is what it is.
Those hamburgers. So yeah, the standard American diet. It can be healthy if people bring in more fruits and vegetables and the fresh plant-based foods that you two had mentioned. But I think that a lot of times people can follow the guidelines that have been set for them and have it completely devoid of nutrients. So from my standpoint, just to add to what they were saying, is I would add that it would be really important to pay attention to the nutrient density. Does it hurt? Does it hurt or does it help? So those nutrient-dense foods are the ones that are going to help you. And also food quality. While, when we're looking at plant-based, I also look at, should we be eating organic? Sprayed are these crops? You can look at the Clean 15, the Dirty Dozen or the Clean 15 to help you choose which foods to buy organic.
Makes sense. Yeah, no, it makes sense. But let me ask this question. So we know that there's challenges going on, and I think about it in my office practice. Yes, I only get a handful of time. We have a finite time as practitioners with our patients. We're trying to get enough information to them as fast as possible. But you don't want it can't be about speed. It's got to be about value. And we have to sometimes, I see myself as a clinician, I have to sometimes slow myself down, and I might have to take more time to try to hit home the points. But let me ask this question to Dr. Saran. Where do you start? So say somebody's coming in, we're talking off air about a patient that I recently saw who came in with just horrible diabetes numbers. The A1C was 13 and some change. A gentleman in his early 50s. He's about 5'9", 5'10", weighs 280. And where do you start? And so how do you start having those conversations, John? Or, people might be out here that are hearing us on today's show, and they might not even know how to bring it up to their own clinician. How do we kind of eliminate any barriers that may be out there for us?
Well, I ask him simply what they eat. It's taking a good history. It's a food diary.
Okay.
What did you eat yesterday, the day before? Give me an idea what your breakfast, lunch, and supper look like. We take into account their ethnic or cultural backgrounds, religious backgrounds. We have to do that, kind of work things around, and then show them the relationship between what they're eating, how that relates to their diabetes, or if they have a family history, they're worried about a mom or dad they had with cancer or heart disease, and they don't want to get those things. Try to teach them that DNA is not your destiny, that most of these chronic diseases we talked about, we can change. We can change those by what we eat. Epigenetics, for example, where the food that we put in our body can actually make some changes of gene expression, maybe hide those diabetic genes we may be carrying, kind of quiet those down and release those good genes that we all have as well.
Wonderful. Lisa,
Yeah.
what's your take? How do you start somebody? Somebody shows up in your office, they're showing up there for a reason. They want to make a change. They just might not know where to go because there's so much information, maybe a lot of even some misinformation out there. How do you start with somebody?
Well, I point out that health creation will begin at the end of the fork. So every decision that every time they're deciding to eat, is this going to create health or will this create disease? Because if the answer is disease, then they have to really think twice about the next bite. And then I remind them that food is medicine. A lot of people come to me to lose weight and they may use surgery, they may use medicine. And to me, I often say, well, food is the best medicine that I can give you. And so once we establish that, then I start really going into what really matters, which is pointing out that the best way to eat food is whole, the way it was intended to be eaten from the earth. I really talk on the point of quality, food quality over quantity any day. For patients that are trying to lose weight, it's very important to look at calorie amounts and things, but it's not going to be as good for them as if they're paying attention to the quality. And then recognizing the power of plants. So if we start recognizing that plants are the first way to start healing, then people can really start seeing big changes. And most of all is individualizing, because we're all very different. We have cultural differences, religious differences. And I think that if that recognition of the culture and individualizing were to take place from patient to patient, we would see amazing outcomes for our patients.
Wonderful. And let me ask that same question to Cristy, and then we're going to get into some of the specific diets because it is called fad diets for a reason. Cristy, where do you start? You see clients in their homes and in other locations, but how do you start when you have a client who wants to make those changes and then go from there?
So I think it's really important to meet people where they are. There's lots of education out there, almost too much, really too much, and to meet them where they are and make small gradient changes. They already have more information than they're using. There's a big disconnect between what they know. So their mom already told them to eat less sugar and more vegetables. Mm-hmm. And so how do we make that translate to the end of the fork? So that's really where I start.
Can I second that
please,
too?
go ahead.
It's really about food choices, which is really great. The old school is kind of like, don't eat this, don't. It's all negative. No, okay, so let's talk about fats, right? There are good fats and bad fats. Let's talk about carbs, good carbs, bad carbs. Let's talk about proteins, good proteins, not so good proteins. So it's about choices. And I think if you give people some choices, tell them how they can weave maybe some of their personal likes and dislikes, maybe just shift it a little bit, I think we can work with the individual.
Yeah, I think we have to really
options.
We have to really now, because we're mired in so much chronic disease, that even though a lot of times the diet is as a personal choice, we have to now, because we're seeing the devastation that's affecting our families and our loved ones, and certainly affecting society, we have to come together and say, you know what, even though there's some individual things we have to respect, what can we do on a larger scale to make the most impact? And so that, so I think it's great that us as clinicians that we're here talking about this, because we still realize the challenges that lie ahead, but we want to persevere. Cristy, you were going to say something?
Yeah, I was just going to add that with the education, it's good for them to see the vision of where they could be. But in the meantime, as we start wherever it is that they are, and then make those small gradient changes toward that end.
I like your idea where they could be, because give them a why, because it's not just do this and this, but to say, wouldn't it be nice if you could be at your grandchild's wedding? Or wouldn't it be nice if you could could do this other life event. I think
Yes.
if you put a why, put some emotion attached to their
Right,
choice, it really makes a big
Yeah,
difference.
give them a little motivation.
Yeah, really look into their values.
Yeah.
Why do they want to do this from their heart? Because we can tell them over and over, you can be linked to this disease or you will have this happen to you. But when you put it on a heart level, that means so much more.
It's another connection, without a doubt. We feel, and I told to my patients recently after a show that I did 2 weeks ago about keeping your why in front of your face all the time. Why you make these decisions, just remember your why. And even if you regress a little bit, as long as you have your why in front of your face, you're more apt to bounce back and thrive, without a doubt. So I want to do this. We're talking food diets. Fad diets, food diets as well too, same thing. But let's get into some of this stuff. And so we already talked about the standard American diet, SAD, or as Dr. Saran saying, crap. I love it. Never heard that one, but Dr. Michael Greger will give him props on that one. But let's get into some of the things that people are hearing a lot about. So we just talked about the standard American diet. Let's talk about a few other ones here. So Dr. Saran, can you break down, briefly, what is whole foods plant-based?
Well, like Cristy said and Lisa said, so whole foods that are from nature, minimally processed, and plant-based. And it means plant-based. I mean that you have to be like 100% vegan, but for the most part, I like Michael Pollan's word. It's eat food, real food, not so much, mostly plants.
Yeah.
Okay, so what does that mean? It's food. It's real food, first of all, and water, and not so much. Portion control is key. And mostly, he didn't say all plants, he said mostly plants. So I like to be a little bit flexible with people and their needs because it's really hard to be perfect. I just don't like people, and I'm not perfect, and I don't think many people are, so we can work with
I told this to a patient of mine yesterday. I go, I am not a finished product. I am not, but no, we always have room to work on ourselves. And again, as long as you keep that why in front of your face, you will continue to hopefully know where you want to go.
So Mark, it's plants. It's fruits and veggies and berries and whole grains, fibers, legumes. It's those as natural as processed, minimally processed as possible. That's what I mean.
And the whole foods plant-based,
nutrient dense,
plant-based diet, or as Lisa says the other night, whole foods plant powered. It excludes flesh, correct? Lisa? Poultry, fish.
Yeah, well, it could exclude if that's your preference.
Okay.
But a lot of the times, even in cultures that we've seen, I'll kind of talk to this. There are blue zones, and these are areas where there was a big documentary done, and they went and found the longest living, areas of long in Japan, Greece, Costa Rica, Italy, where people live well into their 90s and 100s, and so they were looking at what did they all have in common. So yes, community and exercise, but that's separate. The biggest things that they found, which is, cultures throughout the world, even Loma Linda in California.
Yep.
So they found that there was some animal-based products or fish, but it was very limited, maybe anywhere from 2 to 10% maximum. And that includes dairy and everything. So there are some cultures that thrive and they do have very minimal meat and seafood. So I think it is really about finding what works individually. But the term plant-based, I believe the plant-based culture assumes that you're not eating any animal products.
Very well. I met Dan, Blue Zones, written by Dan Buettner.
Right.
I met his brother at a conference, and I thought it was actually Dan Buettner himself, and it turns to be his brother, and he was a phenomenal as well too. They have it rehearsed like crazy. But one of their brothers, when he was in Japan doing the work in the early 2000s, the amount of flesh that they wound up eating in a month was about no bigger than the size of their fist.
Yeah, I just came back from Japan.
Oh yeah, that's
Okinawa.
right. Yeah.
I traveled into Ogimi, where this area of longevity, and what was striking for me was that it was a piece of meat this tiny bit, and then everything around it was whole, plant-based, very, very fiber rich. So such healing types of foods. And in that region, I think it was 67% sweet potato.
Oh yeah, that is.
And let's make the distinction, Mark, with plant-based. We're talking about nutrient dense. I don't even like the word vegan at all because that could really almost mean anything.
Potato and chip vegetarian.
Yes,
Captain Crunch.
Potato chips
Captain Crunch cereal.
and
There you
soda
go.
pop are vegan theoretically. So
I don't like that word either.
I love the word nutrient dense and minimally processed.
Mhm.
So I think that be clear on that is great.
Wonderful. Let's talk about what I call, when I think about my patients and I'm trying to get them to make some of these changes. I believe there are two good diets that could be on a spectrum towards a whole food plant-based or whole food plant-powered, as Lisa says. I love that line. But there are a few diets that are out there that are very popular that can help people to eat more fruits, veggies, nuts, seeds, legumes, whole grains, focusing there, high fiber, high mineral density, less of the processed stuff. I like Mediterranean and then the DASH diet. Cristy, what do you know about the Mediterranean diet approach?
Just kind of following those basic foundational things. So they didn't trying to eat the Mediterranean diet. It was just they were eating what was offered by nature. So you've got the the plant-based diet, but also just minimally processed animal proteins.
Yeah, and it's interesting when
high quality.
And high quality. And, and I think about my patients, I'll say, listen, I don't want you to go from eating McDonald's and Pizza Hut and all that stuff in one day, and then by tomorrow you have to be a completely 180. That's unrealistic and impossible. But you have to kind of work with it. So I always say, start to my patients, can you do one meal per day? Just start with one meal, or even start with a snack where you get the colors of the rainbow on your, or a salad, get the colors of the rainbow, those phytonutrients with the reds and the greens and the blues / purples, the yellows, the whites. Those have so many amazing benefits on the body. So I just say, can you just do one meal a day? And then if you do that, you're already 33% of the way towards that in a full week. And then when you're ready, maybe you start to integrate a second. And then you kind of, next thing you know, you're starting doing this kind of 80-20 rule on lifestyle. What's your take on that, Dr. Saran?
Oh yeah, and be clear again, the Mediterranean diet is part of a lifestyle. And like
lifestyle.
So many of my patients say, "Oh, good, now I get to eat pizza and big bowls of pasta and gallons of olive oil." And
No.
that it is not the true Mediterranean diet, right? And if you go to Italy and Greece, their pasta is a side dish. It's not a main dish, and it's a very small portion size is huge.
I agree.
So,
plants, whole grains, and, your healthy fats, lean proteins. That's what the Mediterranean. I think people can start there as they move towards kind of things like that. And certainly the Mediterranean diet has been at least linked towards lower risk of heart disease, and other kind of disease burden benefits. Whole food plant-based, we're talking about reversing and preventing chronic disease burden. Let's talk about the DASH diet. Lisa, the DASH diet stands for dietary approaches to stop hypertension, and it was designed originally to lower blood pressure. That's also somewhere where people can kind of start out with and choose the right foods. What do you know about some of the DASH diet in your approach, if you kind of mention that to your patients?
I don't traditionally use DASH. I have to be honest.
Okay.
I swing more Mediterranean or whole food, very plant strong. I think that it's, I think that it focuses on salt, lowering salt. I think, I don't think, I don't remember reading in guidelines that it's really whole food promoting, but I think there's a low fat factor to that. And so it's moving patients in the right direction for sure, but it's more of a focus on low fat, salt type eating pattern to hopefully bring down blood pressure.
I agree 100%. What do you know, Cristy, about, some people throw this term out, flexitarian. I'm a flexitarian. Have you heard that term when you're talking with clients and stuff?
I've heard that term. It's just kind of mean you can be whatever you want to be on any given day.
That's what I thought when I first heard the term. But I think from my more reading on it, because people throw it out there. That's what we're doing diet fads. It's more about the vegetarians that have entirely excluded meat-based products, but they're very flexible, occasional. Again, this 80-20 rule on things, but being more just sort of, I want to do more. I want to save nature. I want to be kind to the environment, because we certainly know that one of the best ways to save your environment is to host a vegetarian party at your house. And that's involved to clear for a vegetarian diet is very minimal, and the amount of land that's needed to for animals to graze is very much big. So if we're talking about one of the best things you can do for the environment is really to host a vegetarian party.
So it's move in the right direction.
Move in the right direction.
What most people are doing now.
Absolutely. So that's what I think about flexitarian. I'm flexible vegetarian. Flexible vegetarian. I love that word. What about this thing, Dr. Saran, or Lisa? Either you can comment on this. The MIND diet. What do you guys know about that? People are talking about the MIND diet. MIND.
May I just go for it, and then you can finish. So it's more or less a combination of Mediterranean diet and and the DASH diet
That's
really.
correct.
But you're emphasizing now the mind, so brain. So their brain health are greens, emphasis on berries, fish. And again, we in terms of fish, we like to shade a little bit towards wild salmon and wild sardines. The smaller fish seems to have the best bang for your buck. It turns out rich in omega-3s and really fairly low in contaminants. So mind again is that berries, greens, right? Fish, omegas.
Excellent.
And how would you say, Lisa?
I would say only in addition to that is that it's very, so it's essentially been created to help people heal things like cognitive diseases, particularly, your Alzheimer's and things.
Yeah, it's interesting. Go ahead, Cristy.
I was
Please.
going to say it very much mirrors the food guide pyramid. And so I think this emphasis on grains in the mind diet, just that big inclusion, many of those can be inflammatory. So it's not always what are we doing to feed the brain, because you've mentioned all these great brain feeding foods, but what are those things that interfere with brain health? And so that's something else that I think that it's important to look at.
We've got to keep all organ systems in mind, don't we?
Absolutely. Interesting thing is, it was late last year, I believe, when the World Health Organization came out with a position statement about dementia. And knowing that dementia rates, Alzheimer's rates, or dementia in general, predominantly defined by Alzheimer's, are only going to triple by the year 2050. And so the World Health Organization came out, I believe it was late last year, and said basically the only way to help stave off dementia risk is by eating a heart healthy diet at that time. And so we're talking about the things that we're talking about, the whole grains, the fruits, the vegetables, nuts, and seeds, reducing the meat consumption. But it turns out you have to have that conversation with somebody decades in advance. So those of you that are out there listening to us in their 30s, 40s, or even 50s, you have to set the foundation now for something you might be at risk for a couple of decades from now. And it's kind of hard, and maybe Dr. Saran could talk about this a little bit. When you have your 30, 40, maybe early 50-year-old in their practice, they're not really, they're there for their because they got skin in the game. But it's hard when somebody's doing a million things to think about. I need you to think the long game, 20 years ahead from now. But we have to have those kind of honest conversations, right?
And I think telling them stories, going back to their family history again, maybe they don't want to have those diseases that mom and dad had. And so it's starting early.
Wonderful. Let's do a couple. Oh, please go ahead.
I was going to say, I like that because you can also, looking ahead, you can empower them to say that you don't have to be a victim of your genes. Just because your parents had this does not mean that you have to as well.
Wonderful.
So they have the power to change.
Hey, everybody's got the power to change. Each day is an opportunity. And I would say, we all get those same 24 hours, and it's a matter what we do. We were defined by choice, as a great lifestyle medicine pioneer, Dean Ornish says, we get to choose what we eat. We get to choose when to sleep. We get to choose who to love. We have choice. And again, as long as you keep your why in front of you, you're going to make great choices. That's our goal for you to inspire you to live a healthy and active life. Let's do a couple more of these dietary fads. Let's get into ketogenic. People hear that term, keto this, keto that. A ton of celebrity endorsements out there for keto. What are we talking about? Lisa?
So ketogenic is essentially medium protein, high healthy fat, and very low carbohydrate. So, in our settings, in a healthcare setting, this might be used for the bariatric patient who would otherwise be facing bariatric surgery. It might be used to reverse, type 2 diabetes, but people are using it also as a weight loss tool. So there are different ways to be ketogenic. There is the way of the hot dogs and the bacon and the, that very unhealthy version. But there are actually plant-based versions. There are actually, so you could do it plant-based, you could do it vegan. There's actually a doctor out in Indiana, and she's shown 2 years of data right now with a lot of her patients that she's actually reversed their diabetes. So it is very much a fat. It's showing promise in certain areas if you are doing the right practices. If you're adhering to whole foods, if you go plant strong, which you can, ketogenic, and the high healthy fats are very important if you're going to stick to the right kinds as well. So just like any diet, you can really do it the wrong way, and
Absolutely.
that's dangerous.
Interesting thing that we're seeing, at least from the data, we're seeing some of the, I mean, it's great for the short term, but you're seeing some of this long term stuff coming out with higher cardiovascular risk
Right.
that people are showing up with MIs that have gone purely keto for a sustained amount of time. And so I think the proof is still in the pudding, and I think we still have to see some of the, how it's going to play out. But I love how we have to be innovative. I mean, I think we all want to improve health. You know, the American obsession with diets has been going on long since before the early 1980s when the obesity epidemic took off. So I love the innovation, but we want to make sure we're still doing the right thing, doing right by people, and not affecting their lives. Cristy, go ahead.
And there are lots of people interested in doing the keto diet, and I think there's a lot of misunderstanding around it. And they think if they're just going low carb that they're keto, and that's not necessarily the case. It's enough to put your body into ketosis so that you're, rather than burning sugars, you're burning fat for fuel. So that's why it's so effective for losing weight.
And be careful of the long-term data.
Yeah,
We don't know. For example,
It's
that induces acidosis. Ketones are acid. We healthcare professionals many times talk alkaline, but yet there might be some problems with acidosis, bone loss, and other things that you have to worry about. So individualize. Maybe if there are some short-term gains, perhaps, but I'm a little bit concerned about long-term.
Exactly.
Yeah.
Certainly, in the long term, it's not sustainable.
Let's do one more fad, because we're doing a lot of different fads. Let's do intermittent fasting. People are also hearing that all the time. You're seeing it in the magazines. You're reading it on television, social media. People are talking intermittent fasting. What's the take with that? Anybody?
No. Well, first of all, that could be anything, right? You could be fasting every other day. Eat, fast, eat. Maybe some people on 1 week, off 1 week. I've seen 25 days of eating and a 5-day fast. So 25 and 5, or 5 days of eating and 2 days of fast. So I think what makes most sense to me is really like 12 or 14 hours. It's doable, and it avoids some of that nighttime eating. So their data is this intermittent fasting what it does is reduce insulin levels, reduce a adverse hormone called IGF-1. Growth hormone goes up. Growth hormone is reparative, restorative, decreases insulin resistance. It's anti-inflammatory. It reduces oxidative stress. So it's doing a lot of good things. And but you want to make it doable. It's very doable, I think, to pick a 12-hour time period, whether that be you're going to eat from 6 a.m. to 6 p.m., for example, 12 hours, and you're going to be fasting from 6 p.m. to 6 a.m. So 12 on, 12 off. But be careful again, because you could do it wrongly. Those 12 hours you're eating, you could be eating junk food. No, you have to be eating healthy food during those 12 hours. Then fasting, and it's some good medical data that show that can really help. And it's doable, very doable.
We're seeing some weight loss come out, kind of forces us into a caloric restriction kind of time frame. But the reality is that we as humans certainly have evolved to be able to not eat for extended periods of time, kind of like our hunter-gatherer forefathers. But we're seeing some really good stuff. Actually, New England Journal of Medicine put out something, I believe earlier this month, or was it? Sorry, we're in February. My bad. Early in January on intermittent fasting, some great data.
And I like the flexibility of it being doable. I get home late a lot of times. I eat late. Maybe some of the audience do that. They're doing things with the kids, and honestly, they may not eat till 9 o'clock at night. I'm serious. And so then it gets back to the breakfast thing. So if I'm eating at 9 o'clock at night, at 6 in the morning, I really am not hungry.
You're not hungry.
And I should then skip breakfast, which is, we were told eat breakfast, but look at the time period. Now, maybe at 9 a.m. when I start to look for some food, again, healthy food. So you can be a little flexible there, but I think that kind of 12, 14 hours is very helpful.
People are always looking to fit into a model of a labeled diet, but I think sometimes you can just listen to your body, because we naturally sometimes want to skip breakfast, like you said. And they have that.
If you're not hungry, don't eat. Don't eat just to eat.
The reality is a lot of times we're going to be sitting there and people are sitting at home watching TV, and you forget about that. You lose time and things. You realize, oh my gosh, I just ate 3 bags of chips.
But then you get to the office or work, and then sorry, it's junk food. So you have to be careful. But if you're eating healthy food during that feeding period, that's great.
They might naturally just compress their eating time into an 8-hour time frame, and they're automatically intermittent fasting. They didn't know it.
And you're reducing calories, and you're losing weight, and it's healthy.
Absolutely. Let's get into a section a little bit. We'll do a couple of these, and we'll get into some myths versus facts. We've been having this great discussion, but I want to do a couple. All right, so here we go. I'm going to pick on Lisa first. Is it true that we should fill at least half our plates with vegetables and fruits in a rainbow of colors at every meal and even at snacks?
Yes, true.
Excellent. Please explain.
I mean, the value to that is the fact that you're going to stabilize your hormones very well, and we know that the bodies thrive on non-starchy veggies, the fruits, all like you mentioned, the colors.
Yeah.
A big
colors.
part of that is that it's basically helping the gut bacteria eat well too. So we are comprised of billions of bacteria, mouth to anus. And if we're feeding our bacteria well with these kinds of foods, prebiotic food types like the ones you mentioned, then we will be able to be healthy, lose weight, and kick out the bad guys.
Oh, wonderful. And let me ask this question to Cristy. Cristy, is it true that diets go off the rails when people eat out?
Sometimes.
I'd almost would argue most of the time.
Sometimes. I think sometimes that when the floodgates open, it's a bad thing. But if you go out with a plan, it doesn't have to go off the rails, right? A lot of times because I do have some food sensitivities personally, I will call ahead. I'll call restaurants to find out, are you able to handle these restrictions that I require? So it doesn't have to be. And it's also the restaurant selection. Right. It doesn't mean that just because it doesn't have to go off the rails that you can eat anywhere. Some places may not be suitable. So it's about planning ahead.
And restaurants are changing. I mean, we're seeing more and more. I've got celiac, so I'm gluten-free, and I'll ask for a gluten-free menu, and they're very good about it. And but always be careful. But they're restaurants, and even when you eat at a friend's house, I don't feel badly anymore going over to somebody's house and asking him ahead of time. He said, "Well, I'm sensitive to these and these foods." Just so you know ahead of time, don't feel shy. I mean, really.
Excellent. It's interesting. The American Heart Association came out with a study in 2017 that looked at the amount of calories that people consume at a restaurant for dinner, and something I'm trying not to. I'm not trying to misquote the number, but I believe it was something about 92% of the restaurants, the large chain national restaurants, offer on their dinner. At your dinner, you've exceeded your calories for the day in one meal. Yeah, it was something ridiculous like that. Let's do one more of these. Is it true? I want to ask this one, Dr. Saran. Is it true to rely on supplements as a substitute for real food? What's your take on that?
Well, what we said about the rainbow of colors, people have to realize that those natural colors, not talking about artificial, those natural colors have a great antioxidant. So they neutralize some of the dangerous things that we come across all the time. And they are way more powerful than vitamins. I think if you talk to people, they kind of know about vitamin C and E and things like this, but they have to realize these colors are just so much better at neutralizing toxins and keeping us healthy. And so people know, well, they say, D-Jock, I know I don't eat well, but I take all these vitamins. So they realize they maybe are missing something. So they reach for isolated, fragmented vitamins. And there is just no study. There've been meta-analysis after meta-analysis in our annals of journal.
Yeah, the medical journals, correct.
Journal that eating isolated multivitamin or isolated vitamins just does not help those chronic diseases. So now there's a caveat. So work with your healthcare professional is key, because you might be iron deficient for some reason and may need a specific B12 deficiency or vitamin D. Okay, that's fine. But don't just go to the shelf and start reaching for vitamins. Instead, we want a whole food-based supplement. I myself take a product called Juice Plus, which is whole food based. I do not take a multiple vitamin, for example.
Yes, I heard. You want that food base. Let's get into something called, because we're getting a little short on time, but I love this discussion. We do it every week on To Your Health with Dr. G, myths versus facts. Time flies. Ain't that the truth? Yeah. Myths versus fact. That's what we do each week. What it is about setting the record straight. What I do is I ask my panelists, I say a statement, they say myth or fact, give us a kind of a few liners on why it's a myth or a fact. We're going to keep it kind of go boom, 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 boom. We're going to get through as many of these as we can, but again, we want to build trust and deliver truth, setting the record straight for you. First, myth versus fact goes to Lisa. Here we go. Myth or fact? Healthy eating is complex and challenging. Myth or fact?
I would say a myth.
Please explain.
Well, really, as long as you're going back to the basics, you can make it hard on yourself, or you could just follow the basic rules of wholeness and getting the staples in. So I think the more we create the standard American disaster, people are agonizing over their food. So go back to the basics, treat it as fuel. It's just information, and that's it. Take the emotion out, and it's simple to do.
Wonderful. Here we go. Myth or fact? This is the Cristy. Myth or fact? To lose weight, you have to give up all of your favorite foods.
Myth.
Please explain.
Mhm.
There are lots of healthy ways to create alternatives, and especially getting in the kitchen, preparing your food yourself rather than getting it out of a box or a bag or a window. So you can always make your favorites at home.
I agree.
Oh, what I tell people
Please.
that they can have their 100% chocolate or coffee or tea straight without all the extras, and that these are okay. They're just so happy about it. So yeah.
Mhm.
Well, that's what I think one of the studies said. A fifth of all the calories you consume each day are liquid based, and so when you doctor up something like that, like we do, all of a sudden you had a fifth of my calories, if not even more. And so we think about it, it's all liquids.
And portion size is so important. I mean, you can't be serious about it. I mean, it's a small, but that's not what we do, right?
Yeah.
We have to eat the whole box, the whole bag, the whole gallon of ice cream. I think learn it's simple, learn in sharing, learn in when you go out to a restaurant, eating party meal, taking some home. I mean, so there's these simple ways that you can work around that. You don't have to be perfect all the time.
I agree. Here we
Yeah.
go. Myth or fact, Dr. Saran, here's a statement. Breakfast should not be skipped. What's your take on that?
Well,
fact?
we should not be skipped. That's a myth because we just talked about intermittent fasting, for
Yeah.
example. It depends when you ate last night,
Depends
the
when
night
you ate, yeah, I
before,
agree.
really. So in general, with the usual standard, people mostly be eating around 6 p.m. You do want to start with breakfast around 6 a.m., a healthy breakfast. And so I'd say it's myth. It depends on
I
when
agree.
you ate last.
We'll put like myth, and then we'll put an asterisk next to that
It
one.
depends.
What-
That's a good answer.
I know, it's myth. Let's do this one. Here we go, Lisa. Myth or fact? You do not have to avoid all You do not have to avoid all fats if you're trying to improve your health or lose weight.
That is a fact.
Please
there
explain.
there are very healthy fats, omega-3s. When a baby's born, first sustained on protein, carbs and the fats, healthy fats. So
Via breast milk, absolutely.
exactly, and it keeps a baby alive for up to 6 months. That alone. So we have to think about the power of healthy fats, nuts, seeds, avocados. Their brain power. They help us thrive in the right context in the right amounts.
Wonderful. Here we go. Cristy, here's a statement. Myth or fact? You should limit highly processed and packaged foods as well as processed oils.
Fact.
Please explain.
Oh, I thought that stood alone.
Oh yeah, it really does. It's like,
I mean,
put the
they
rest of
really
there.
process-
Limit processed foods. What?
that they started with when they came in their natural form.
Absolutely, and then certainly when you do all that kind of processed stuff, and even those high fats. The high fats, the calorie, not calorie dense, but they are calorie dense because they can be high calorie, but very nutrient minimal, nutrient poor, without a doubt. Here we go. I like this one, Dr. Saran. Here's the statement. I like this one. Consume a variety of foods. Myth or fact?
Fact. We need a variety of foods. We need a variety of rainbow colored foods. Our biome is really
Yes.
based on a variety of foods. It's been shown. So definitely fact.
Yeah, I say eat every color of the rainbow. You should do that. You should strive to do that at every meal, including your snacks.
That's
Yeah.
natural,
Yes.
healthy food.
Yes, yeah, not the color of the
Not
rainbow.
a variety of
I think
fast foods.
Lucky Charms cereal has the color of the rainbow
Right.
as well too. So absolutely, thanks for the
Okay.
clarification.
Different color.
Here we go. We'll do a couple more of these. Lisa, this one's for you. I like this one. All right, going vegetarian will help you lose weight and be healthier. Myth or fact?
I would say, just taking that face on, that's a myth because you could be vegetarian in many ways, like we were saying with the vegan, that could be eating, the Doritos and things like that. So it could be done very well and help you heal, or it could be done, not so healthy. So
I agree 100%. Here we go. Cristy, we'll do the last one for you. Myth or fact? I like this one. When advising patients or clients about diet, information given must be evidence-based and grounded in documented fact.
I think that's a myth because before we had documented facts, people still ate food. So just go back to that.
Yeah.
I mean, I think that oftentimes we want to complicate it much more than we have to. If we just look inside ourselves and listen to our bodies, oftentimes we just know what to do. It's
Yeah.
natural.
And nutrition studies are very, very hard to do.
Very hard.
Very hard
Very
to do.
hard.
It's hard to
Yeah.
isolate a variable.
Yeah, absolutely. So there you go. You guys got myth versus facts. So we have about 5 minutes left, and I've just been enjoying this amazing conversation. I can't believe that the show is almost over. I got a tear coming down my eye, without a doubt. You can't see it from the camera angle and everything, but just been having a great discussion about nutrition, about diet fads, and really I want you guys to take this information again. We want to share it as much as possible. So I said in the beginning, the chief complaint, why people come to your office, so to speak. At the end, when we're done with our assessments, what people we call that the assessment and plan. That's when we give somebody a diagnosis, we give them a strategy or treatment plan, and most importantly, we have them follow up. That's the most important part of everything. So let's bring it on home. Cristy, give us a few take-home points for people to be successful when it comes to their diet/nutrition.
One, I think, is being mindful. Know what's going in your body and always look for real food. And what I mean by that is these plant-based foods we've been talking about the whole hour, but also high quality animal proteins, wild-caught fish, grass-fed beef. So I think that's a good place to start. Just being mindful, cook your meals, cook at home so you know what you're eating. So be observant, be mindful. And one thing that my family does almost every day is green smoothies. I think that's the best way to eat the rainbow all at once and get a lot of your veggies in on the front end, front loading.
Wonderful. Well, thank you, Cristy. It's been a pleasure having you on the show.
Thank you.
Lisa, bring us on home. Give us a few take-home points for people out there that are listening to the importance, but how can then again they take what we're talking today and turn that into action steps?
Yeah, just focus on the whole factor. I tell my patients a lot, if you bought a Corvette and you were told to put in 93 gas and you put 87 in, your car will not run right. We've become accustomed to eating 87 gas foods. We need to amp it up to 93 to feel well. Honor your culture. My is 90, thriving. Her food was consisted of a lot of quality. So I think focusing on quality and then really focusing on the liquid calories and how much that plays a role, because you could consume so many additional calories just through drinks. So if you really, really look at that, and then one size does not fit all. And that's where I think we need to start focusing is on the individualizing for patients.
Well, thank you, Lisa. Again, it's been my pleasure having you back on the show again. Dr. Saran, take us on home. Give us a couple take-home points out there for people to be successful on what we're talking about today.
Well, I'll go back to Michael Pollan.
Please.
To eat food, not too much, and mostly plants. Those are 7 words. It doesn't get much simpler than 7 words. Eat food, not too much, mostly plants. And that, second of all, to really avoid some of the toxic foods out there, processed food. We mentioned some of the sodas and things like this. So avoid artificial things, avoid processed things, eat as close to nature as you can. And we're not perfect. We're all busy people. When you're consider if you're considering a supplement, a whole food-based supplement rather than isolated vitamins.
Wonderful. Well, thank you, Dr. Saran, for coming on the show. My final thoughts are this. When applied fully, healthy eating patterns help treat, reverse, and prevent chronic disease burden. But I realize that eating patterns and eating just in general boils down to an individual choice. And oftentimes we have to live by those choices, but because of the pressing disease burdens that we are seeing each and every day, we have to take action. We must do more, and we have to do more. My job as a physician is to effectively counsel my patients about general healthy eating patterns, because I will fight for their life as hard as I can. And in essence, again, healthy eating patterns are a way of life. So that's my show today. I want to thank my guests. It's been a great time. I want to thank my great guest, great good friend, Dr. John Saran. Again, check him out. Board certified internal medicine physician. He's at Edward Hospital. Check him out, www.eehealth.org. He's also an affiliate physician with MDVIP. Check him out, www.mdvip.com.
Thank you, Mark.
My good friend Lisa Murphy, board certified advanced nurse practitioner, Endeavor Health Weight Management. Check her out as well, Edward-Elmhurst Health, www.eehealth.org. Great friend Cristy Chuparkoff, registered and licensed dietitian nutritionist. Check out on her LinkedIn, linkedin.com/n/Cristy Chuparkoff. You've been listening and watching live on Facebook and IntellectualRadio.com. This episode is written by Mark D. Gomez and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis. Copyright 2020 by MDG Wellness LLC. All rights reserved. Stay tuned for my show next week. It's entitled The 411 on IBS. And again, if you enjoyed today's show, share it as much as you can. And of course, check me out on my website, www.drmarkgomez.com. We'll catch you guys next time. Peace out.